Hello, guys. Welcome to my channel. I'm Dr.RAYLEE. Today, I want to share something I have observed these past years with our health workers, hence the title, A Disturbing Truth About Health Workers. This is my observation so far, or my experience so far, as I pay close attention to the conversations of many health workers like our doctors, our nurses, our midwives, our specialists, our lab technicians, and so forth outside their work activities. I noticed one disturbing truth that I thought I should share with you. And I want you to share with us in the comment section of this video if you have also observed what I'm about to talk about. The number one thing that moves our society or controls our world is money, and our health workers are not left out. I realized that the only few health workers are actually passionate about their health. Only a few percentage of health workers actually pay attention to their health status and that of others. Many of them ventured into the health sector because of money, and that is very disturbing. And I'm going to tell you why it is so. You see, a lot of doctors, nurses, and all the other special areas under health see the health sector as a means to escape poverty, hardship, and make a lot of money. And that is good, okay? Making money is good. But I'm going to tell you why it is very disturbing. And how do I know this? It's very simple. Don't take care of their health and that of others properly. And it is very interesting to know that the very people running the health sector are not properly taking care of themselves. And that is sad. Many of them are sick inside with very bad health habits and they die prematurely. Sad. What do you think? Whilst they advise us to eat healthy, they themselves don't. They tell us to stop smoking, whilst many are heavy smokers. They also tell us to quit eating late at night, and yet they do the opposite. They sit in their offices advising people to quit drinking alcohol, and yet many of them are heavy alcoholics. Isn't that sad and very disturbing? So those of us, or those who are supposed to be pacemakers of society in terms of health, are the ones who don't do what is right, because many of them were never passionate about health. It was all about money. It is business and not passion, and that is very disturbing. To prioritize money above health is a very disturbing truth or character. You see, because if you are truly passionate about something, it starts with you, by your speech and then your lifestyle outside the four corners of the hospital. They are supposed to set good examples, right? But they don't, sadly. And like I always say, you are what you eat. And many of these health workers do not eat healthy. And it will surprise you to know that many don't even know what a healthy food is or how to eat or live healthy. That is very surprising. To them, it is all about the prescriptions, the procedures, the surgeries, take this and that, and at the end, they are paid. And I have seen too many of them very unhealthy and dying of avoidable diseases from lifestyle. And this is a very disturbing truth. What do you think? When I was growing up, I thought, and I still think the same. I think the healthiest people should be health workers because they get first-hand information on living healthy. They take care of the society first, so they might be first fit and healthy to take care of the rest of us. What do you think? That is right. That is reasonable. Because I think the health workers should be healthier than the rest of the population. But sadly, it is not so. Because many of them are driven by money. The health sector is not truly their calling. Now, personally, for example, everything that I share with you, before I get to tell you, I have to be an example first. I have to practice what I'm telling you. You see, there are so many things that I didn't know. But once I got to know about living healthy, I started doing them. So when I share any video with you, I am very confident because I am doing likewise. I have practiced and I've seen the results of that thing that I'm doing. So if you follow what I tell you in my videos and I don't personally, you get the benefit of being healthy whilst I become unhealthy. And that will show in my lifestyle as I go on, as I get older. And personally, I am passionate about health. I am not money driven. I don't venture into something because it'll fetch money or a lot of dollars. No, not at all. For example, my channel, the videos that I bring to you, I spent thousands of dollars investing in these things in my channel. And yet my money or my channel has not been monetized. I have not monetized my channel. It's very easy for me to monetize my channel. And I've not done so. Why? Because my mind and my heart is not towards money, making money. It's about my health first and your health. And I do a lot of free consultation and other things that will fetch me money, but I get them for free. Whilst others are charging, which is good on their side, I don't charge anything. I could make a lot of money by the things I do, but I do them for free because my mind and my heart is first towards your health and that of mine and not making money. So my true calling, my second true calling is actually health. And that is why I do what I do. Because I think if you are passionate about something, you will never be discouraged. You never complain. And above all, it brings fulfillment. And that is the most important thing in this life. That is fulfillment. So I prioritize passion and fulfillment above money. And that drives me towards living a healthy life myself. And then helping others also live a healthy life. And not because I want to charge them. So my mind, my heart is about passion and fulfillment. So if I ask you, for example, the work that you are doing, if you are not being paid for, we used to do that job. We used to be passionate about that job. To many of our health workers, the answer is no. They are there because of the money. And that is one thing that we need to be careful about. And this is very important because if you find a health worker who prioritizes money above passion, above health, above fulfillment, that is very dangerous. And this one thing I observe with many health workers, they are not passionate about their work. They are money driven, and this is a very disturbing truth because it shows personally in their lifestyle and that of others and the way they handle patients or somebody who is sick. But I am passionate about health and I prioritize my passion, fulfillment. So whatever I'm doing, I do wholeheartedly without charging anything. But we can't say for many health workers, and so this is the disturbing truth that I want to share with you. Now, if you have observed what I'm sharing with you, let me know in the comment section and what you think we can do to help our health workers become more conscious of their own health